Good afternoon, and welcome to the webinar on evaluating the outcomes and impacts of your community health needs assessment implementation strategies. I am Deborah Thompson, President and Founder of Stratagey Solutions, and I'm delighted to have the opportunity to be here today to talk with you about this important subject. Over the next 45 minutes or so, I think we'll provide some hopefully useful information that will be actionable for you in your individual organization. For those of you who may not be familiar with Stratagey Solutions, our company has the mission to create healthy communities. And we've, over the years, it's our 20th anniversary this year, we have worked with organizations in all sectors and really try to help create cross-connections within sectors, because it takes all the sectors in a community to actually create a healthy community. And we are really passionate about our work supporting health improvement implementation strategies. So what are we going to talk about today? We're going to talk about how to approach program planning, particularly the outcomes measurement process of it, in order to evaluate impact as the IRS requires for the CHNA implementation strategies. And we're going to give you some tips and tricks to help you determine how equipped you are to evaluate the outcomes and impact of your implementation strategies, and show you some examples of what evaluations look like. Now, just in terms of providing some context, the letter of the needs assessment regulations is that we have to do them every 3 years. But really the spirit of them, even though there's some requirements, is that the entire system is moving toward population-based health planning and a healthcare delivery system that focuses on the triple aim: lowering cost, improving healthcare quality, and improving overall health. Now, we're in this sort of interesting middle ground, and I love this slide that I actually got from one of the ACHI presentations at the conference this year. I love this depiction of this transformation to the second curve of healthcare, where we're sort of moving from hospital fee-for-service to totally accountable care organizations and really being responsible for the total health of a population. That's kind of an evolutionary process. And what we found is that it's helpful to recognize where your hospital or health system is in that community health improvement evolution, because what we feel is that over time, and the more people are involved in work on needs assessments and implementation strategies, they sort of move up this hierarchy. I developed this slide back in 2014 because I started seeing back then that there were some organizations that were moving toward looking at social determinants of health and collective impact and collaborating with organizations across sectors to address root causes. But yet there was still some people who were just doing these needs assessment because it was required by the IRS from a compliance-only perspective. And what I found is that there are organizations that are sort of all across the continuum as we move to the second curve. And there's actually a great research brief done by the American Hospital Association on this idea of aligning prevention, wellness, population health, and community health improvement strategies. And I've labeled that previous graph with both the first and second generation strategies because, again, many organizations are on this journey of trying to figure it out. And what we see is that many organizations are still struggling with not only where they are in that evolution, but the organizational and departmental buy-in and what I call herding the cats, so to speak, to get everyone really involved with reporting on activities and outcomes measurement, not to mention reporting community benefit dollars. Because we've also found in our work with hospitals and health systems that lots of good work is going on. There's wonderful things happening in a lot of organizations. We don't necessarily track them well. We don't necessarily evaluate them well, even though most clinicians that I know and most hospital administrators that I know are evaluating everything they do every minute and doing a lot in terms of improving what they're doing. They just don't write it down. So I'm here to talk about today, encouraging you to write it. Pick a point in time, get a group together, and write down and document your conversation. And there you have an evaluation. That's the really simplest way to do it. But there's a more formal approach that we'll talk about, and we're going to encourage you to really think about what your plan is to evaluate impact and actually put it into a publishable format. So back in the final IRS Community Health Needs Assessment ruling back in December 2014, in addition to attaching the CHNA implementation strategy to the Form 990, okay, they spoke about annual updates should be included on the Form 990 describing the actions that you took in that tax year to address the needs identified in the strategy, or if no action was taken, why. So there is actually some precedent, I guess, for this idea of doing an annual evaluation, although I always tell people to go back and talk to their auditors or to the individual who is signing the 990, because their interpretation of the regs are what the policy is for your particular organization. And we've seen different auditors and different financial folks that are involved in submitting 990s actually have different interpretations of the regs. It's pretty clear, though, that each CHNA report itself must include an evaluation of the impact of the actions that we're taking since the last one. So this concept of creating an evaluation chapter, as I mentioned earlier, we're going to give you an example of one. Creating that chapter in your needs assessment is pretty clearly outlined in the IRS regulations. So we encourage our clients to think about doing both. And I'll explain to you as we go forward here today kind of the tips and tricks for each. And we'll send you some examples along with this slide deck. So how do you evaluate impact? This is the big question for today. You conduct a program evaluation. That's pretty simple, right? So what is a program evaluation? It's a systematic method for collecting, analyzing, and using information to answer questions about projects, program, policies, and programs, okay? Particularly about their efficiency and effectiveness. So we do an evaluation to say, is that intervention strategy that we're doing, is it efficient, is it effective, and does it get us to the intended goal? So if you want to improve or establish, if you've never done it before, your evaluation process, when you're first getting started, it's really a good idea to start to ask the right questions. And these are the questions that we believe that you should be asking yourselves as you start thinking about evaluation. The first question is, are you actively implementing all of the strategies and programs identified in your needs assessment document? That's in your implementation strategy. Are you doing anything about it? We've seen lots of organizations that write an implementation strategy and then it sort of sits on the shelf until their next needs assessment comes up. And they continue to do their community benefit programs, but they're not necessarily actively managing the plan. Back to the whole idea of both the letter and the spirit of the IRS regulations is that we are actively managing what we say we're going to do. So it shouldn't be a document that just sits on the shelf. Then the next question is, do you have a mechanism in place to track, measure, and report on the outcomes and impact of each of your strategies beyond the number of people who attend or participate? Many organizations have lots of programs, but the thing that we most easily track is the number of people who participate. And even sometimes that's challenging to get our arms around. And when we're working with clients on developing an implementation strategy or creating the infrastructure to manage these things well, we actually recommend having somebody designated as the coordinator of just this document. And maybe that same person also collects the data or pulls it all together in one place, because you might have different people doing different programs. We suggest that you have somebody be the person that gets the data and puts it all together in one place. That may be the same person as the coordinator, but it's a good idea to have somebody collect it all, even if you're manually collecting it in various places for various programs. And then the third question is, have you attempted to compile it to create a report that includes all the data? Because some people have the data, they don't necessarily publish it or get it all in one place to publish it. And we recommend that you go through the exercise of doing that at least twice a year, once at the end of the year, but also at the 6-month mark, to see if everything is working the way it's intended to. And then the question is, has your implementation team reviewed the compiled data to determine whether or not those strategies and programs are doing what you wanted them to do? And then our last question is the answer to any of these questions, if it's no, do you have the ability to ensure that all these happen before the end of your fiscal year? Because you do want to have somebody tracking what you're doing, and you do want to pull the data all together in one place. So how do you get started on that measurement and evaluation process? Well, these are the strategic questions that you want to ask yourself. The first question is, what do you want to accomplish through those programs? So this is the beginning of the logic model concept that we talked about during the last webinar. What's the overall goal or the intended outcome? Another question that you should be thinking about is, how important is measuring the collective impact of efforts with community partners? For example, we've worked with a collaborative group in one county that there was a variety of different collaborators, health departments, health districts, hospital systems, that were all doing different types of healthy exercise and weight management programs. They spent some time actually thinking about what indicators they would want to collect. So even though their programs weren't all identical, but there were 2 or 3 measures that they could all collect so they can put their data together and say, this is what we're doing collectively. That's an important question you want to ask yourself, because if you are collaborating with others, you want to talk about those indicators that everybody might share a common measure. How important is population health, and how do our program implementation strategies tie in with our population health strategies? To what extent are we looking at social determinants of health? To what extent are you capturing all the community benefit investments? And I want to stop there for a second and just encourage you all, if you're not connecting your measurement and evaluation work with your community benefit tracking work, there's some value to thinking about those 2 things together. Because we found in several of the organizations that we work with is that they were doing lots of community benefit programming, but they weren't always accounting for all the time and effort and materials and costs that they were putting into those programs from a community benefit tracking perspective. So you want to track those things at the same time and make sure that you're taking credit for all the good work that you're doing in your communities related to community benefit. And, you know, how do these things fit with your mission? Those are always good questions to ask. Now, why would you do a program evaluation? I should have put in red across this slide, because the IRS said so. But aside from that, you want to make sure you're ensuring transparency and accountability, that you have some measurement of outcomes and impact, that you form the basis, that it helps form the basis of future programming, that it informs those who provide and administer programs, and it provides information concerning what works and what doesn't work and why. Now, there are 3 types of evaluation, and you might be doing different types of things related to evaluation depending on where the program is. So there's formative evaluation, which aims to improve the program structure or implementation. Summative evaluation, which assesses the merit or the worth of the program. Is it worth it for us to do this because we've gotten some outcome? And then there's a developmental evaluation that's intended for programs that are being changed as you work on them, because they are things that you really want to make sure that they perform well, but you're kind of building the plane as they're flying it, or as you're flying it. And as I mentioned in the last webinar, our program evaluation approach really balances good need-to-know applied science with proper methods, data collection, and analysis. So while we try to follow good methods, we are not research purists by any stretch of the imagination. But we try to do it practically so that you can get good outcomes and you can actually report on what you're doing in a reasonable way without, spending millions of dollars just on the evaluation approach. And a couple of terms that I maybe should have put earlier in the presentation today, but what is evaluation? Again, that's systematic investigation, and the program is the effort being evaluated. Now, why did I say this? The program, that term program, can apply to any action. It doesn't have to be a formal program. So any implementation strategy for the purposes of this evaluation discussion is I'm calling it a program or lumping it in as a program. So you can have various types of programs. And I would guess that in some of your communities, you're doing different activities and interventions, and you may not be calling them programs, and you may not be evaluating what they're doing. Okay, like most of us think about programs as direct service interventions, such as a program that offers free breakfast to improve nutrition for grade school children. That's a direct service intervention. A lot of our mammography screening attempts are direct service interventions. But other things can be a program and could be impactful and could and possibly should be part of your community health improvement efforts, such as community mobilization efforts, research initiatives, surveillance systems, advocacy work, okay? Many of us are doing education and advocacy work as part of our intervention strategies, but we're not necessarily counting it as one. We should. What I call social cause marketing campaigns. And many hospitals do this by having posters about washing hands to stop the spread of infection. But you may also have infrastructure building projects. Community building, for those of you familiar with community benefit, is an important component of community benefit, but we may not be counting some of those things as part of our needs assessment implementation strategies. It could be a training program. It could be some administrative system. So all of those count and can be part of your evaluation process. So how do you improve or establish evaluation capabilities? Well, looking at the magic 8 ball ain't the answer. But here's the process. First, you want to identify the current condition you want to change and the program goals. You would develop a logic model, as we talked about during the last session. You then identify the outcomes and impact measures and the tools to collect the data. You will talk to then your IT professionals to create data collection and reporting systems through existing electronic applications when and where possible. And I put the little note on there to do a commercial about the webinar that we're doing on October 24th is devoted to automating outcomes indicators. So we're going to specifically talk about that part because I have a little soapbox about, tick sheets on nurses' desks are not the way, and putting those numbers in Excel is not automating your outcomes indicators. So we're going to talk about that in a dedicated way. And then you implement an evaluation process and develop that progress report, which is the document that says what you're working on and what might be needing to be changed, etc. Now, I want to address a question that someone sent to me via the chat feature as I begin to talk about this part of evaluation. Because in some cases, those of you who are listening have all the data, you're collecting it, you have it, well, what do I do with it? I don't know what to do with it in order to create that evaluation report, and I don't know what to do with it to see that it gets submitted with the 990. So I'll talk about that as we go forward with this, because the format of how you document this is really up to you. As I mentioned, when you get the slide deck, you'll also get a couple of examples of evaluation chapters. You could do it however you want, really. We just finished a really cool 2-page one that a Health Foundation hospital system put together that I don't have to send you yet, but we'll try to get it to you folks when it's finally published. It was a really cool summary of what they really accomplished over the last year. And they're having it made really pretty by a graphic designer. But all you have to do is write it down in some type of format. So you start with your goals, because if you don't know where you're going, any path will get you there. And before you want to start, again, you want to talk about the overall goal, what's going to be evaluated, what criteria is going to be used to judge the program performance, what the standards of performance might be to be considered successful. You know, like, for example, if we're going to be doing mammogram screenings, what's success for us? If we screen 10 people, if we screen 100 people, we should be talking about what we would like to accomplish through that process. And what evidence are we going to collect to let us know that what we've tried to do for an intervention actually works. So I'm going to walk through this process and show you an example because of some work we did with West Georgia Health, which is now Wellstar West Georgia Health. They did a lot of push around reducing incidence of chronic diseases, particularly around cancer. So their goal, and they track this, and they use their internal cancer registry data, their tumor registry data to track this. It's not the public health data on deaths. They're using the tumor registry data, which I think is a cool piece of data that a lot of organizations have and can get access to, but don't often use in their evaluation. So their cancer-related objective is to reduce the number and percentage of patients diagnosed with stages 3 and 4 cancers of all types. The idea is we're going to intervene, we're going to do screenings, we're going to intervene early and catch people. So we want the early stages to go up, we want the later stages to go down. And then we look at each particular program and we start to think about, okay, what are the program evaluation measures, the process and output measures, outcomes, and impact, like we talked about specifically in our last session. So in the West Georgia example, well, what's going to be evaluated? These were their high-level intervention strategies and activities that were outlined in their last needs assessment in 2016. They were doing Paint the Town Pink or other annual events and screenings, outreach and education programs offered to public and affordable housing complexes. These were the strategies that they had going on. We also worked on and created a logic model that outlined the activities, the outputs, the outcome, the short and medium and long-term outcomes. And notice that these are numbered because you want once you have a logic model, as we talked about the last time, you now want to translate these things into what are you going to actually measure so that you can get the data to complete your evaluation. So you can track and count your numbers. At the event, numbers 1 and 5 and 6, you know, the number of people participating and the number and percentage of people who schedule mammograms. Then after the event, you want to find out the number and percentage of participants who followed up and did the mammograms within a particular time frame, and you set the standard. And then you want to look at the number and percentage of participants receiving mammograms who were actually diagnosed. But that requires some type of follow-up and tracking after the event. But and here's how they did it, okay? You know, the number of people diagnosed with breast cancer by stage. Now, these are their actual numbers. We want stages 0, 1, and 2 to go up, okay? So 1 and 2s were actually going up, even though 0s were coming down. And we want 3 and 4 to go down, which 3 has been going down. So this is a way to evaluate the impact of the activities. And we show here the things that are measuring behavior change. And again, going back to the logic model, when you get the copy of the slides, you can actually go back and see these questions here related to the specific outcomes and short and medium term outcomes from the logic model. And here's another, measuring satisfaction, which is an output. This was number 2, related to the measurement. So that's your first thing. Get that set up, get the data and tracking if you don't have it in place. And then you set up your evaluation process yourself. And these are the steps in the evaluation. And I'm going to talk about each one of these as we move forward. We also recommend an evaluation process schedule that is done in the months following the end of the fiscal year. Now, most organizations, 990s or tax returns are due 5 months after the end of the fiscal year. So if your fiscal year ends in December, the 990s are due in May. If your fiscal year ends in June, your 990s are due in November. But some people file an extension as a matter of practice. So if you get an extension, they're not due until the following May. So for those of you who are questioning, how do I get this actually reported with the 990, one of the first questions that you want to ask yourself or find out is who's filing the 990 and when are they filing it? Because there are specific questions on the 990 that relate to the follow-up from the needs assessment, and who's ever completing your 990 and I wish I had a copy of it, the actual 990 form that I could pull up on my computer and show you. But there's a specific question that asks about, you know, what have you done on any of your implementation strategies. All you have to say on the 990 form is see attachment X, and then put a copy of your report as that attachment. It's really that simple, and probably the more complicated thing is figuring out who is actually filing the 990 and how to get your report as an attachment to it. That may be a little more challenging to figure out. But you want to be able to, throughout the fiscal year, collect your data. The month after the fiscal year end, start to compile all the data. Set a date of which you want to look at and look at the results and gather feedback and input from stakeholders. Now, that input can be gathered a variety of different ways. What we recommend is the simplest way is if you have a steering committee for your needs assessment or an internal steering committee that's working on the implementation strategies, set a meeting date and convene that group and have that group give you input on the progress. One of the example reports that we're going to send with the slide deck actually shows how West Georgia did it, and basically documents the conversation that the team had looking at the data, and then that's the evaluation report. And they would update their action plan every year based on the comments that they got from people. So you don't have to do a wide swath, but they also did a number of other things, like one of the things that they did to improve their cancer program was to try to decrease the time it took from a diagnosis to surgery and or chemotherapy. These are also things that were indicators that the Commission on Cancer were looking at. Well, 1 year as part of the evaluation process, interviews were actually done with physician office staff about that process and how it was improved to get their input on whether or not they felt it really made a difference in terms of patient care delivery. So you can collect feedback from other stakeholders. You can also, again, just put people together and then prepare a statement or a report like we recommend and submit it with your 990. You can also put it on your website along with your needs assessment report, and we recommend that. So these are the steps. Engage the stakeholders, describe the program, focus the evaluation design, and again, it could be as simple as a meeting. Justify your conclusions, and then share your lessons learned. So what does that look like? Engage the stakeholders. These are people who have something to gain or lose from what's being learned. So it could be the people involved in the program. It could be the people served by the program. You could do a little focus group of people who are participants. You could give it to the intended users of the evaluation, which is the people who are running the program, so that they can get better information about how to improve it. Then you want to describe the program, which could be the logic model, the context, the need. You could document this as robustly or as simply as you like, but you want to be able to outline your goals and what you're trying to achieve somehow. Then you look at the evaluation design. And what's the intent of the evaluation? Are you just simply trying to get insight? Are you trying to improve how it's done? Or are you trying to determine the effects of the program and measure the impact? Well, in the cases of the needs assessment implementation activities, you're really wanting all three things, because you do want to improve it, what you're doing. You want to assess impact, and you want to get some insight about how it might be better. So then what you do is you gather the data and look at the skills, compare the changes in behavior over time. You can decide where to allocate new resources or stop doing some things and start doing others. Document the level of success. Demonstrate that accountability is being done. These are all what you want to do as part of that process. And then gather the evidence. And it could be from a variety of different places. It could be observations of people. It could be a process evaluation where all you're doing is reporting that we did something or not. Like, for example, if one of the things that you're doing to improve access to care is changing, let's say changing a registration process, the fact that you implemented a new process and simply did that is the outcome. Some impact might be, you might have to measure impact later using a different technique. So there's lots of different techniques that you can use to gather data. It could be a written survey, it could be an interview, it could be an observation, it could be a group assessment, it could be a testimonial, it could be some storytelling. All of these things are valid methods. And then you want to justify your conclusions by going back to your standard. So if your standard was that you wanted 80% of the participants to have improved their knowledge about a topic that you're presenting and can demonstrate that, well then you have to say, did our results get us to the standard that we wanted? And do we have some recommendations there? So you want to have some process where you're saying, okay, we came to a conclusion based on the data that we had, and the conclusion tells us this, and then we have a recommendation, either continue what we're doing or do something different. And then you want to create some recommendations, possibly solicit reactions from multiple stakeholders, and possibly present options instead of giving directive advice. But again, if you have that steering committee, together a group can decide what they're going to do, or if you can have an external evaluator, or you can have your own internal group kind of give recommendations back to your steering committee. You can set it up a number of different ways. Now, what kind of format do we want to use? How do we we got all this data, how do we document it and put it together? Well, here's one evaluation framework that I liked. And this actually came from the state of Maryland, who put into place a few years ago their requirements for community benefit reporting. And there's actually instructions that go with this. But their framework for every implementation strategy, the hospitals have to report what the need was, what the initiative was, what the metrics were. Was it single year or multi-year? Was it collaborative? How were the outcomes evaluated? What were the outcomes? Is the initiative being continued or not? And what was the cost? So here the state of Maryland is forcing the hospitals and health systems to marry community benefit cost with outcomes reporting. So I like this framework because of that, even though it's a little cumbersome to put all that data together. Here's an example from the West Georgia Medical Center's report from the conversation that their steering committee had about it. So you could see what their goal is to reduce incidence and prevalence of chronic diseases, what their objective was to decrease late-stage breast cancer diagnosis. Their action steps were continue to offer Paint the Town Pink. We have outcomes measures there, the number of participants and the number of vouchers that are given out. And also they were looking at further downstream, what were the impacts? How many events they had, how many people were screened, how many were given vouchers, how many actually showed up, and how many were screened in different events. And then there's a section on here for the evaluation comments that really describes kind of what happened and what they plan to do in the future. And then the action plan will be updated for the next year. Again, it's pretty straightforward and not all that difficult. It just puts it all together. Here is a chart that came out of the Indiana Regional Medical Center's needs assessment. This is the other example of the evaluation report we're going to give you. This is just an interesting way looking at people to count the numbers. But as you can see here in fine print, the percentage of people that had an increase in knowledge based on the diabetes program, so their outcomes are actually the numbers. The impacts are actually the numbers based on the short-term impacts are the numbers that are inside the little people at the bottom that shows the percentage of people who had an increase in knowledge based on those particular programs. So where do you go from here? First of all, you want to ensure that each of your implementation strategies and programs are currently being implemented. Secondly, you want to establish those outcomes and impact measures through some mechanism. Develop a progress report format, and we encourage you not to wait until the end of the year. We suggest doing it in the middle of the year so that you can pull some data together. And if you have all the data together, facilitate a discussion of what's working and not working, and then document the conclusions and the next steps. And then once you have that document that says, okay, here's our data, here's what we measured, this is what we're going to do next time, you want to write that up in whatever format you're comfortable with, and you make it as pretty as you want to make it, and then you attach it to the 990 and make it an attachment. Figure out who's actually completing the 990 in your organization and when it's going in, and make that document an attachment to the 990. And you could also post it on your website if you'd like to report those on an annual basis. But if you do it only once every 3 years, you should do it as a chapter in your next Community Health Needs Assessment report. And then you have your evaluation. It doesn't have to be complicated. It doesn't have to be particularly labor intensive, but it should reflect the type of intent that you want to have in your organization related to your outcomes measurement. So in other words, if your goal is to have continuous improvement and make sure that those strategies are hitting the mark, you want to create that evaluation process as a point-in-time activity. Get the stakeholders involved that you want to have involved. document it into an example, and then include it as part of your 990. Anyone have any questions? So I do have a couple of examples. For those of you who are still on the line, I'm going to share my desktop and show you these examples. This is what we're going to give you as part of when you see the slide deck, a year one evaluation report. There's an executive summary that shows the data of the outcomes. It's just a narrative. It talks about the methods of how the steering committee came together, what they talked about, what the qualitative feedback was related to the data itself and from the steering committee members, and then draws conclusions at the end. This group actually rated whether or not they wanted to continue to do the things that they had done in the past using an audience response polling system, but then included each of these various summaries of the data related to each of the implementation strategies as an appendix. So again, that's one way of doing the annual evaluation. And this example shows this was a 3-year evaluation of the Indiana Regional Medical Center's implementation strategy that talks about the various programs that they did, the different measures that they had, what the outcomes and impacts were of the various things that they did over the 3-year period. And this was put as a chapter in their implementation report. So we'll also share that with you as an example. Okay, and embedded in the next CHNA, do you recommend? Yes, somebody asked me, there's another question that was asked. If embedded in the next CHNA, do you recommend it be at the beginning or is it appendix at the end? I think that's up to you. I personally like it as a chapter in the beginning because it sort of sets the stage for what the next thing is. But we've done it both ways. We put it as an appendix at the end. I think that has everything to do with what your style is and what you want to get out of your CHNA. So that's the answers to the questions that I have. Do I have webinars on that topic? Okay, here's another question. Do you have webinars on that topic of how to educate folks in our organizations on the importance of capturing the data? Actually, we do. And we can add that. It was not part of the webinar series that we have scheduled right now, but we can certainly add that to the agenda if there's interest in that. Okay, their interest in that. If there's additional interest in talking about the importance of capturing the data. And I understand that a lot of you folks are using Community Benefits Tracker, which is a really good tool. And I think it's more important how you engage people around the concept of community benefits. And the software is a tool to help capture what you're doing. But it's really only a tool. It's the process that's as important, if not more important. Are there any other questions? So thank you, everyone, for spending time with us today and hopefully learning a little bit about the evaluation system and process.